Hi, and welcome to Top Farmers Know How. I'm Sean. Mastitis reduces milk production, milk quality, and animal well-being, costing you time and money. In this video, we'll cover off how to prevent and monitor mastitis during lactation after calving is over. Improving our milking routine can help us prevent mastitis from occurring. The aim of milking is to remove milk quickly and efficiently without stressing the cows, damaging their teats, or introducing mastitis-causing bacteria into the teat ends. As a general rule, if you have more than 5% of cows acting unsettled during milking or kicking off the cups, it is an indication that you could improve your milking routine. Here's a brief review of the basics. The first step is to bring the cows into the shed in a stress-free manner. Try not to push cows to make them move faster on the lane, or squeeze them into the yards with the backing gate. If cows aren't getting to the shed in time for milking, you can let them out of the paddock earlier so that they can move at their own pace. Research has shown that mastitis risk increases with poor udder hygiene, so keeping tracks well maintained and yards clean will also help prevent mastitis. Cups should only be applied to clean, dry teats. Wipe dirty teats with a dry paper towel before applying the cups. Of course, it is preferable to prevent teats from becoming dirty rather than having to clean them in the shed. Always wear gloves during milking, and clean or change your gloves when they become dirty or covered with milk to minimise the spread of mastitis in the shed. Cup cows up in a calm and consistent manner, allowing minimal air entry into the milk line. When a cow is finished milking, remove the cups by cutting off the vacuum, allowing them to drop off by gravity. Don't pull them off with physical force. Effective teat spraying after milking is the most important thing you can do to prevent mastitis. At the end of milking, all cows should be sprayed with a commercial teat spray product. Mix it according to the label instructions with clean water every 2 to 3 days. For hand spraying, apply 20 ml of solution per cow. Increase the volume to 30 ml per cow if you use an automatic teat sprayer. However you apply teat spray, it is important to check that you are achieving adequate coverage of the entire teat. Mastitis-causing bacteria enter the udder through open teat ends, and if the teat ends are damaged, infection is much more likely. Keep an eye on teat condition through lactation. If you notice a lot of rough teat ends, this could indicate that the vacuum is too high or that the cups are staying on too long, leading to over-milking. Over-milking is much more likely to cause mastitis than under-milking. Studies have shown that up to 500 ml of milk can remain in the udder without increasing somatic cell count. So, rough teats may indicate that you need to remove cups sooner. This will also help with cow flow and milking speed. If you're not sure about teat end condition, teat spraying, or over-milking in your shed, you can get your shed and milking routine checked by a milk quality expert. They'll be able to help you adjust the routine to suit the cows. In addition to perfecting your milking routine, it's important to keep the shed well maintained and to remember to change your liners after 2,500 cow milkings. There are calculators available online which make setting a date for liner change really easy. For more information on the milk plant and shed maintenance, visit Dairy New Zealand's Healthy Udder website or contact a milk quality expert for advice. Even when you're not in the shed, you can use several monitoring tools to get an overview of mastitis on your farm. Your bulk milk somatic cell count is the easiest to watch. A sudden spike in cell count could indicate that a clinical case has slipped into the vat. A gradual increase over a few weeks or months could indicate a contagious mastitis problem is developing. Top herds keep their bulk milk somatic cell count below 150,000. If your bulk milk cell count is rising, you can conduct a herd test or RMT the herd to identify those individual cows that are responsible for the increase. Talk with your vet or milk quality consultant if you're unsure what the changes in your bulk milk cell count are telling you. Your clinical case records are another great monitoring tool. SmartSam recommends that if you have more than one clinical case of mastitis per 100 cows milking per month outside of calving, it's time to ring your vet or milk quality consultant. There are so many moving parts to the milking routine and many different ways to check that things are running smoothly. Hopefully, the best practice tips we've talked about in this video are useful references for you this season. Check out our other top farmers videos on mastitis and dry off to learn more.